I'm going to be talking more about creating a startup practice, which may not be relevant to everyone, but I'll try to focus on at least, the points that some are practical and some are just things to think about regardless of what type of practice you go into. So by way of background, I'll just tell you a little about me. So I did my residency in PM&R at Spalding, which is the Harvard program, and then did an interventional pain fellowship at Brigham and Women's. And during that time, I thought I would definitely stay in academics. That would be the one thing that I was really gung-ho about. So I started working on grants. I actually got grant funding even as a medical student, and then worked on these different trials, published in JAMA. I had published in JAMA actually about 20 times, and then after finishing fellowship and doing all of these different things, I just kind of got disillusioned as an attending a little bit. I was working at an academic center, and I felt that I wasn't really getting the chance to do all the things that I had envisioned in my mind. I felt more like I was a super fellow or something, just like the next stage of fellowship. So I continued with that for a bit, and then I thought, well, maybe I should go kind of to a different direction, to the VA, where they do value research and these other things, but at the same time, it had the reputation of being the VA spa. Now, I have sort of an intense personality, so once I got there, I was at the VA in Manhattan, and we were the referral center for all the other VA hospitals, just sort of in the New York City area and New Jersey. So it got pretty busy. I actually really liked that. I was the chief of pain management, and I was doing a ton of procedural cases all the time, all the cervicals. They didn't have a lot of other board-certified pain specialists, and some of them, even if they were board-certified, didn't have the equipment. So I was doing that for a while. Then these other opportunities came along. I started doing more segments for TV and started doing these national news segments. And then I wanted to pursue that. And you would think that if you have a lot of different interests, maybe academics or maybe the VA are the right places to be. But then I found that there was a lot of office politics and these other kinds of things as well, some other constraints. So kind of going through this process, I realized, well, if I really want freedom, if I really want to make the decisions for myself and kind of decide how to budget my own time, then I kind of need to be in charge, not have a lot of different bosses. So that's how I sort of in a roundabout way came to creating a startup, which I did about 2 years ago, and it's in downtown Manhattan. And so I'll tell you a little bit about that process. I made a lot of, I think, different mistakes. There was a lot of inefficiency, but for those who are interested, I'll kind of go through those mistakes, highlight them, so that hopefully, you guys can avoid them. And then also, I still have a relationship with NYU. I'm an associate professor there, and then I'm the medical contributor for Fox. I don't have any financial disclosures for pain, but I am a consultant for Doximity, so I do mention them for one moment in this talk, but I just wanted to give you a heads up about that. All right, so practical things. So let's say if you're a fellow and you're planning to start your own practice, or if you're already working for another practice and now you're planning to start off on your own, the first thing you want to check if you're already working for someone else is, do you have a non-compete clause? Do you have some geographic distance where you can't work? Because you want to make sure before you start planning everything for a practice that you don't get into legal trouble there by starting a practice somewhere where you legally can't. And just one thing about that, just remember, if you work for a hospital and you have a non-compete clause, it may not just be the main hospital or the main site of the practice. There might be a lot of different satellites that you're not aware of, and does your non-compete clause apply to those too? Because then it might be a much greater distance than you had originally imagined. All right, so let's say that you want to start your practice. What's the first step, at least in my opinion, it would be to take a look at your state sort of directory, all the paperwork to see how do you actually start a corporation or start a company. And there are different kinds that you can do. You can start a PC, which is a professional corporation, or you can start a P.L.L.C, which is basically a limited liability company. So without getting into the weeds, the idea there is one is actually set up a lot like an actual corporation in terms of the taxes. The other one, you pay some higher startup fees, usually initially, but then once you're over that hump, then you can kind of take it through there, take it from there. So there are different things that you'd have to do as you go through these records. Now, you can hire someone to do this for you. But I would say if you're really starting on your own, you want to try to limit how much you're spending. So there are always people who can help you, but if you can do it on a shoestring budget, be aware of what all you need to do, and then hire somebody for specific things, like a lawyer or something else. You want to make sure everything's done right, but as much of the legwork that you can do, if you can do it, that'll actually make it easier in terms of the costs, and also you will learn a lot about the process that can be useful afterwards. Now let's say you want to start this small business. Well, I'm in the New York City sort of tri-state region, so I had a choice of kind of deciding, do I want to be in New York itself, like the city itself? Do I want to be sort of across the river in New Jersey or on the other side in Connecticut? And some of the things that might make a difference, not just where you'd like to be, but what's the state's tax laws? What are the other things involved? And I started a P.L.L.C. So the thing there is that you're starting a company. It's sort of the same as being an independent contractor, but the difference is I don't even know exactly how this came about, but it's sort of, you have to do these publications. So as soon as you start the company, a notice about the company has to be sent and published in these different areas. So at first I thought, well, that's not too bad. Maybe I can put an ad in the New York Times or something, bring some patients in, but it's not that kind of publication. It's very specific publications that nobody reads. So we're not talking about an ad. So essentially all it is you fill out the paperwork, you pay some fees, usually to another company to kind of send this out in these different journals that nobody reads, and then you have a corporation. You have to consider legal fees also, because even if you do a lot of the legwork, you want to make sure, especially if you're starting your own company, that somebody can kind of look at it. A small business attorney is the type of attorney that you want to make sure that you actually have done this properly. You want to check all the licensing requirements, your professional medical license, and then also check naming conventions. So this, at first, so my practice is called Metropolis Pain Medicine. I am board certified in pain management and fellowship trained, but I thought, well, I don't know, will I attract too many opioid-seeking patients with this? Not that I'm against that, but I just didn't know with the name, well, do I want to call it something else, like sports and spine or something else? So I was trying to think of these different names. Well, when I tried to do that, which was my initial application, I actually got rejected by the state, and after this whole appeal process, finally I talked to someone and said, well, why can't I name it Metropolis Sports and Spine? I'm in PM&R, and then they said, no, you're trying to masquerade as a chiropractor because that's the expert in sports and spine. We don't know what you are, and you're an MD, so you can't have that name. So some of this depends sort of on who you're dealing with, but then it kind of reached this point of, do I want to argue with this person, or do I want to just take this name and kind of get started with this? So I would say this process takes a lot longer than you might expect. I would give it, if you're lucky, this could take a few months. Now, starting an LLC without the P in front of it, professional, can be done sometimes in about 24 hours. But because you have the professional component, which we are professionals, it has to be a PC or a P.L.L.C. if you're doing something medical. Going through that process actually takes a little bit longer. So as much information as you can get as possible before submitting an application, you want to do that. You want to check to see, does somebody else have the name that you want? Somebody might have the name, but just not be on Google. They may not have opened the practice, but they actually own it already. Same thing as if you're looking for an email address. So there are sites, usually on the state's website, that will help you look up what names are taken. So this is a site for New York State where you can search for business entity names and stuff in their database. Now, you have to think, even if you're by yourself, your corporation is also a medical provider. So while you have a social security number, you also want to get a tax ID for your practice, and you also want to get a group NPI. So at first I didn't understand, well, I'm only one person, so why do I need to have a group NPI and another, tax ID? I can just use my regular stuff. But the way it was explained to me, which makes the most sense, is that let's say today I want to be by myself, maybe 5 years from now, or even less than that, I want to bring on other people, maybe a nurse practitioner, a physician assistant, maybe other doctors. Well, they're all going to be billing for the practice. So I don't want to be stuck with this problem at that point. I'm better off getting everything set up right at the beginning so they can use that group NPI and group tax ID. And again, fill out all the tax information appropriately. So here, kind of under number 3, I check off limited liability company, in terms of how the practice bills. Now, you have to do something called an Articles of Organization. This stuff you could probably get on Google. It's generally, every corporation has to have sort of an Articles of Organization. But it basically says sort of, what exactly are you doing as a company? What's your existence? What's your mission and stuff? Now, in terms of address, another thing I kind of sort of did inefficiently is I thought, well, now that I'm ready to do this, I'm ready to do all the paperwork, now, let's get to it. So it's sort of circuitous. If you want to set up a corporation, it'll ask you, well, what's the corporation's address, right? But in order to have a corporation address, you have to have a lease, let's say, your office space or whatever else. But if you wanted to put the corporation's name on the lease, how do you do that? So you're sort of caught. So the way to get around that is basically, there are different ways. You could use your home address and then just get the mail there. This is basically mainly for paperwork. But the problem is if you put your home address on there, then it's going to be listed on all these state websites when people check for corporations. So they'll have all your information. You could use friends and family's addresses. I thought of using my parents. Actually, this was because my small business attorney told me, well, if I live in Manhattan and I use a Manhattan address, remember, costs in Manhattan are a lot more. So all those publication fees, everything else is going to be much, much higher, thousands of dollars more than if I were to set up this business elsewhere in New York State and then just say, well, we're moving to the city now, or we've opened our office in the city, which is all legal. But you want to think about that. You want to, if you're going to do something in a specific state, maybe set it up for these purposes in the cheapest county that you can find. And then ultimately what I also did was I just got a UPS box, which you can do. So at Penn Station, which is right near me, they actually have sort of one Penn Plaza Suite 2192 was our thing, which is just mailbox 2192 at the UPS in there. So it's important because the state's going to send you all this paperwork. Insurance companies need to have some address as you're applying to join them if you want to be a network. And so you want to have this place where you can get all the paperwork and have the time to get these things done without already starting to pay a lease where you can't see patients yet, for a place where you can't see patients yet. Insurance, I would say this is the other big decision to make. Do you want to be in network or do you want to be out of network? It depends, and it's not that easy of a decision, like, oh, well, if I'm out of network, maybe I'll make more. If I'm in network, I'll get more patients. So people kind of go both ways. I would say it also depends really on your relationships. So when I started, I thought, well, I'm going to be in network. I'd rather see the patients. I think that's what I'm used to, having worked in academics and stuff. I'll just stick with that. Well, sometimes the insurance companies don't want you. So when patients call, or even when we call, we always say, oh, do you accept this insurance? Do you take this insurance? It's not always like that. I mean, the insurance company is much bigger than a lot of small physician group practices. They may say, no, we don't want you. And I had that experience too of getting rejected. So then I thought, what is this? Like, maybe they don't know that I have a lot of background, so I'd write these letters. I got letters of recommendation for the insurance company, and it really didn't do anything. So I was wondering what's going on. And then I went to talk to our chair at NYU, who told me, no, that's because you're just a small fish. So if they can kind of get rid of you, if patients have to wait longer because there aren't as many pain management specialists, that saves them money because a lot of people get better or just generally fall by the wayside. If they have to wait a long time for a cardiologist, that's a different story, right? So I was lucky because then NYU brought me in and kind of put me with their university physicians network. So then being in network was actually sort of similar to having out-of-network rates. But I would say this is something to kind of investigate and consider first, like, do you have relationships with an academic medical center, not for the title, but to actually have some good relationships in terms of insurance companies if you're going to go that route. And you also have to have a realistic assessment of how many patients you can attract to your practice when you're making these insurance decisions. Now, it's easy for all of us to look at it like, well, if I'm a good doctor and I do all of this and I offer great care, then I'm going to have a ton of patients. But remember, there's a lot of competition out there and around you, and you don't know how many of them are going to come to you. There's a lot of ecosystems where people tend to refer to each other, and they have other good relationships too. So you want to have some kind of assessment about that. You also have to think about, when you set up your practice, where do you want to be? Now, this applies not just for a startup, but just sort of in general for a practice. What kind of patient population are you going to be attracting? When I started at the VA, I worked at a couple of different VAs, but the first one I was at was a suburban one, sort of outside of Manhattan, and I thought, oh, okay. Well, you know what? This one had no residents rotating through it, which I thought, okay, well, I've been like the super fellow at an academic center, so that's nothing to me. But the difference that I realized was that we had a lot of strange things going on with the patients in terms of the opioids and all kinds of other stuff. So as residents and fellows, you might think, well, certain patients, what are they being prescribed or what's their regimen. But I'll say this, at a teaching institution, at least there's a lot of monitoring. You know, not everything may be what you think is ideal, but there are a lot of eyes looking at this patient. There's a lot of people who can ask questions. If you're at some place where you're the only person that sees this person, there's not really a lot of teaching and training going on there, you might see a lot of different things. So I found this, you know, to be very unusual in terms of the pain prescriptions. Then I moved more to Manhattan. I transferred to the Manhattan VA, and I found that it was also a different, very different population. Patients who live in Manhattan and come to the Manhattan VA generally tend to be very functional, to be able to walk all over the place and get all over the city, go up and down the subway and travel. So it was generally a different population. A lot of the veterans we saw were people who were working in the city, but they came to the VA because of their benefits. They wanted to get their you know, if they could get a procedure for free, if they could see their regular primary care physician through their regular insurance, but then come get their medications at the VA, then they preferred that. So very different type of patient population. And like I said, I was doing a lot of procedures at this VA because of the way that the whole system was set up. Then I kind of came to the financial district, which is where my practice is now, and I thought, okay, this is perfect. Well, actually, you know, I was ready. I had done so many procedures, so I was like, okay, now I'm ready for anything, you know, as an attending. I'm on my own, but I've got, you know, at least a lot of this stuff under my belt. Well, the patients that come to see me now don't really want as many interventional procedures because why? They're working like 80, 100 hours per week or something, wherever in the financial district. They're not that eager to have a procedure. They might want a procedure more than they want opioids, but at the same time, they're more, ironically, into regenerative medicine. So that's how I sort of got into that area now, because I had a lot of patients who had a lot of, they're weekend warriors who have these various injuries, and then basically were like, you know, do you do PRP? Can you do PRP? And then things started moving in that direction. So wherever you go, you want to think about it more carefully. Not just, am I in private practice or an academic medical center, or what city or state am I in, but what kind of population is there? What kind of ecosystem is this that I'm going to be dealing with? Now overhead, like what George was talking about. So there are a couple things to think about. You know, there's clinic and procedure space. Now, if you're in a place where real estate is relatively cheap, these might go together, that you might have just a medical office suite with everything together. For me in Manhattan, when I was starting, again, I didn't want to spend a whole lot of money on all these things before the patients came in. So I thought, well, clinic space I can get probably relatively for less, because a lot of physicians share clinic space, right? Primary care physicians, surgeons, anybody, you have to have clinic space. But procedure space is a little bit more expensive because you need to have the lead-lined walls, you need to have the C-arm there, you need to have a lot of equipment, so that actually adds to the costs. So at first I was sort of seeing patients in a clinic that I was renting rooms from a primary care physician as a timeshare, and then I was doing cases at a surgery center. But as things developed, I just started renting procedure space the same way I was renting the clinic space at a different place. And then now, you know, as things expanded even further, I kind of have my own space. But you want to think about different creative ways of doing this, whether it's buying something, leasing something, subleasing something, and again, the location and whether anything will bring you more referrals. If you sublease space in an orthopedic surgeon or neurosurgeon's office, then you may get more of these types of procedural referrals. If you're in a primary care physician's office, you may get more patients, but it's going to be the types of things that come to primary care. So it's a little bit different. And then renting space, you want to think about what's your relationship with this person as well, because you can rent the space, but you can't pay them for the referrals, right? That's illegal, so just to be aware. Things to remember in terms of insurance, you know, I was always thinking about malpractice insurance. That's the big one. But actually, starting your own business, you have to think about a lot of different types of insurance. There's small business insurance. There's workers' compensation. So workers' compensation, meaning if you hire employees and they get injured, you have to pay for this type of stuff. You need disability insurance that maybe you offer to your employees. Cybersecurity insurance is another one that we had to get. And then location-specific policies, meaning because we're in the financial district, we actually had to get anti-terrorism insurance. So a lot of different things to kind of consider as you're going through this. Now, staffing, this is probably the most important thing, trying to figure out who are your employees, because this is going to be the face that the patients see first, not you, the person who answers the phone, person who schedules them, person who responds to them when they walk in the door. You know, what's their impression going to be? of this person. So of course we might have in our mind the ideal type of person that we want to handle all these things, but how are you going to find that person, right? So what I noticed is as I was placing ads and doing interviews, well, the person that I have in mind who might be sort of like an extension of me is not always looking for this type of job, right? So that's another issue that you have to think about. And then what are you going to include in the contract? I mean, me starting out, you know, I didn't want to promise this person however much per year because I'm trying to keep costs down. I'm trying to figure out, well, hopefully this all works, and I'm kind of putting all this together. But these are things to kind of consider. Are you going to be able to offer this person health insurance? Are you going to be able to offer this person other benefits, right? So I started out, I looked at Indeed, I looked at LinkedIn, I looked at some of these different things online, and then I realized at first when I was putting down receptionist, because it was me and then this one other person starting out with a whole bunch of sort of contractors, like a billing agent, you know, the accountant, the lawyer and stuff, but I thought, I don't really want a receptionist. That's what I realized after doing however many interviews. What I really want is somebody who's like an office manager, who knows how to do all different things like me, but maybe they start off answering the phone at first, because I mean, there are doctors who answer the phone on their own, but you have to think about, how do you want your practice to look? Like when you're starting out, maybe it doesn't matter. You know, some people answer the phone and kind of respond, but I think sometimes it looks a little more professional, even if you're paying this person and they're not getting many phone calls at first, to have this other person be the barrier, you know, or your representative and stuff. And ultimately, I actually decided, you know what, I'm just going to hire students. Like a lot of them, pre-med students, they have health insurance, maybe through their parents or through the school, and maybe they're more willing to help me with all these various things. I wanted a website, I wanted all kinds of other things done, which I felt like the millennials were generally pretty good at, not to be stereotyping people and stuff, but actually, it worked out really well because I worked with people then who suddenly didn't have a specific job description in mind. Actually, I will say I did hire someone before the students who had a lot of experience as a receptionist, but then what happened was I remember asking her to do a couple other things, like to research just, oh, you know, what are the hotels in our area, because maybe, you know, we're in a tourist area. Maybe we should put some cards in these hotel lobbies or something. And then she said, no, that's not what I do as a receptionist. Meanwhile, this is before we had a lot of patients. So then I thought, well, this doesn't make sense. I'm paying this person full time, and you know, I'm going to be doing every single thing. I mean, these things happen in certain big institutions, but in a small business, you want someone who's motivated to do the same things as you to grow the practice and stuff. So I'm not saying to hire students. I'm just saying think about how you're going to find the person that you want, and whether what that person has in mind fits with what you have in mind. So another thing, so as Dr. Verghese was talking about this morning, the electronic medical record. Now, I don't want to get into all, I haven't found a good one that I like or anything like that, but I will say I had to go through the process of changing EMRs, which was horrible. The reason I'll say that is, first of all, we're all used to using the electronic medical record usually in a hospital. I mean, I had used it in residency fellowship. The VA is all electronic. So I thought, oh, what's the big deal? I'm used to working with all of this stuff. You know, it's a pain no matter what, but I can deal with it. Well, the difference is, which I didn't realize, when I was working in the hospital, before I started using the EMR, this thing had been tested by however many people in the hospital to make it more customized for at least pain management, you know. So even though it was cumbersome, there was something about it that sort of flowed for pain management. Whereas when I started on my own, I realized, oh my God, I keep getting these pop-ups about flu vaccine and every type of vaccine. Did you ask the patient about their pap smear? You know, and all kinds of stuff for every single patient. So you have to go through this whole process of customizing the EMR for yourself, potentially, you know, and then unless you get one that's specific for pain, in which case, I'll just say the reason I had to switch EMRs is because once I became part of NYU, you know, not officially, it's still my practice, but to be in network with them, they wanted something compatible with their Epic system, right? So mine, that I had finally spent all these months and however long customizing, they said was not compatible. So now, you know, you have to switch to one of the others, which I'll tell you, once you have all your patients in one system, trying to take them and move them to another one is also very difficult and an area for error. So when you pick this thing in the beginning, just make sure you have the rest of the plan sort of outlined as much as possible. And just other things to think about, are you going to get your billing services through the electronic medical record? Are you going to hire an agency to help you? Are you going to hire a scribe, which I actually did now, it's too much, but these are all things to think about. There are different EMRs, in terms of office setup, think about all the things that you need, office supplies, medical supplies. You have to figure out your phones and your fax. Fax is only really in medicine, but you could get an e-fax. How are you going to scan and Xerox things? What devices are you going to have? Are you going to have an ultrasound device? Or are you going to have disposable equipment? So these are things to think about. I ordered a whole bunch of stuff on Amazon. How are you going to get all these things, and how do you know how much to order? These are important things to think about. Now, the ACIP Medicare fee schedule, this is on the ACIP website. When I was in fellowship as an attending and at first and at the VA, I didn't really understand the value of this. Not that I was against it, I just didn't know how important it was until I started doing things on my own in practice. So the reason it matters, you might bill something and then get paid, or code something and then get paid a certain amount. But when I was trying to decide if I was going to buy this ultrasound device, here's the thing, an ultrasound device, let's just say it's about $30,000 to $35,000 approximately. So if you're going to buy this device, rather than starting with the mentality if I must have it, you have to think, well, is this worth it, right? How many cases am I going to do using this ultrasound to make this worthwhile? Like, how long is it going to take me to pay off the device? So then you have to think about, well, what code would I use to pay for the device, or for each procedure that I do with the device? And how much do I get paid for each of those codes? And then you have to kind of do some math to figure out, what do you need? Or do I really need all of these kits for doing a procedure, or can I break it down and buy the things individually and then save money there? So it's important to realize how much will you get paid, because how much of that do you want to spend on the supplies. With phones, especially because I was doing something a little bit more unorthodox, I wanted to do something, I'll just mention Vonage, because they actually had sort of where it's a virtual phone, a Wi-Fi phone. So I could be at home, I could be anywhere else, we'll get phones. Same thing with the receptionist. When I started, I only started 2 days a week, and then later expanded to 5. Because 2 days a week, why do I want to pay for office space 5 days a week if I can have it for 2? But still, somebody has to answer the phone every day, because otherwise the patient's not going to be able to schedule an appointment, right? But with the Vonage, I could have somebody at home, pay them less to work from home, and have them still answer the phone as though they're in the office and schedule the patients. And similarly, Doximity, like I said, I'm a consultant for them, but they have an e-fax, which is free and HIPAA secure. And at the same time, they also have something called Doximity Dialer. So if I was to call a patient from here now, it will look as though I'm calling from the office. So although technology can be a burden sometimes, there are certain things you can use to your advantage. Payments, I thought payroll, I don't think I can afford payroll, so what I'll do is I'll do the payments on my phone as my mobile app, and just transfer the money. Square also in terms of doing payments, and just different things. I'm kind of going over time, so I'll just say, in general, choreograph each movement with your office. Make sure everybody's on the same page, and think about, how are you going to keep track of different things? If you make medical record requests, who's keeping track of which ones have gone out and which ones have come back in? If you've ordered MRIs, who's getting the pre-auths? And has the patient actually gotten the test, and have you gotten the results, for the MRIs and x-rays? Your procedures, who's keeping track of coordinating all these different things? And then payments, this is another big one, make sure that whoever's collecting the payments, there's some system where that all the payments are sort of actually going into your bank account. So, copay sheets. If somebody's changing their address, do you have forms for that? If there are bank errors, I've had checks swallowed up by the ATM. And if patients are paying cash, well, they paid cash. Is there some proof that they paid cash? Because we've had also, a situation where a patient said they paid cash and there was no record of it. Well, then what do you do in that case, try to put as many things, if possible, if you can, on your phone. So here, for example, I don't know if you guys have this, but the e-prescribing from your phone, so you have to put in the security code. It makes it easier for opioid prescribing, but as much as you can, try to think about all the different things, your environment, all of this other stuff that can help. And I'll just say, in terms of being in network, just think about your environment, try to get everything to match from the start. And sorry I went over here, but so much to talk about, so thank you.